Welcome back to my channel Health Tips 23, where the focus is on health and nothing but health. Last time we discussed, the last video was about minor disorders in pregnancies. And just to recap, we said some minor disorders in pregnancies were like morning sickness, and like more for morning sickness, it normally goes up until about the 14 weeks of pregnancy, where, as it says, morning sickness normally occurs in the morning when the mother wakes up out of bed. All right, we have things like pica, which is food cravings, and where the mother will crave for food, like most times food that are non-nutritious. For instance, the clay, the ashes, the body powder, and sometimes salty food and things like those. All right, we looked at constipation. Yes, constipation is one. All right, we have excessive salivation, where the mother will just want to just keep spitting up, spitting up. For some mother, even if they're going out, even the public transportation, they have to travel with a cup that they can spit in. Right, that's how bad it is. And sometimes these lead up to um, hyperemesis gravidarum, where you have excessive vomiting, because sometimes the mother will vomit after salivation. Right. We have varicosity, and the varicosity, it can be most time the legs, and it can go to the vulva. It can go to even in the rectum. That is one of the causes of hemorrhoid, or what you call pile. Right. We have things like chloasma, where this is a discoloration of the skin, but it goes, as you know, it's pregnancy related, so most times it will subside after the pregnancy is the baby is delivered. All right, we have like heartburn. Yes, you have like heartburn, and this is because of the baby that pushes up the growing baby, and then it pushes up when the mother eats, then the digestion is delayed. Yes. So because of that, she will experience that. But we normally advise the mom to eat in small amounts, and avoid lying down after immediately after eating. Okay, we have yeah, I think that's basically it for the minor disorders, and that why we have discussed, not to say there is no other minor disorder, but based on the previous video. All right, we have danger signs in pregnancy as well, because we looked at the minor disorders and the danger signs in pregnancy. All right, danger signs, we look at, for instance, headache, where the mother is having persistent headaches, and she has chest pains, edema, where the hands or the feet are swollen, and the face as well are swollen. We looked at like bleeding, because during pregnancy the mom is supposed to bleed after missing her first period, her period, menstrual period, that is. then she is not supposed to be seeing any blood again until when it's time for the baby, when she start labor, right? So if there's any signs of bleeding, then the mother will have to see, go to the clinic, the health center, or her private gynecologist obstetrician will be GYN. The last time that I spoke about this, I mentioned going to the clinic, they see a doctor. Well, my apology to my midwives out there, because the midwives are the backbones of the health center. And once the mother is pregnant and goes to the clinic, then the first person that she will likely to be in contact with is the midwife. Right. So my apology, midwives, for not mentioning you as the person who is supposed to be seen, because not everybody will go to a private doctor. You know, some people, most people go to the health center, right? And the midwives, like I said, they are the backbones of the health center. So my apology. So if these signs are present, then go to the clinic. All right. Like some mothers will experience a little bleeding after after the menstrual period. But like for instance, I think for the first 7 days, and when implantation is taking place, then she can have a little bleed, which is not really so detrimental to the life of the baby. But then we don't want to take anything for granted to say yes, that is it. So go to the doctor. All right. If there's anything like passing of fluid from the vagina, where you have a gush of fluid coming down or anything, it doesn't matter what time in the pregnancy that occurs, the mother is supposed to go to the doctor, because if once the membrane is ruptured, then the life of the baby is at risk, especially if there is no medical person in attendance. You know, that means the person is out of hospital. So we advise them, once that occurs, to go to the hospital immediately. Yes. Also excessive vomiting, where we would think it's hyperemesis gravidarum, because with this the mother cannot keep down anything. So there's no need to say, I'm gonna stay home and I'm gonna watch it, and I'm gonna try this and I'm gonna try that, because once she tries to eat or drink, then she's going to vomit up back. And then with this, she's losing fluid and electrolytes. So intravenous infusion, where a drip is put in, that's the only thing that will help to ensure that the mother is hydrated. Because, like I said before, the vomiting and so on, you can be dehydrated easily. And if whatever affects the mom, then of course it affects the baby. So if the mother is short on her nutrients, fluid, and all the works, then if the baby will eventually be affected. So we advise her to go to a doctor. Yes. Also, that's we will be discussing this in subsequent video, because this is something that we want to discuss on its own. Vaginal infections. this is something again that if the mother experiencing things like those, then go to see a doctor, because some vaginal infections can cross the placenta barrier and it can affect the baby. Also, if left untreated, it can be dangerous when the baby passes out through the vagina at birth, because this can cause blindness and other congenital conditions. So we advise you, once there is sign that a vaginal infection is imminent, then see a doctor. Of course, sometimes the vaginal infections, it the vagina is very delicate, and as I mean, in times of pregnancy, then because of the hormonal changes, the vagina changes its normal flora from acidic, because the vaginal flora is mostly acidic. So then with this now, the hormonal changes, it's less acidic. So any bacteria, anything comes across it can easily get infected. So it's advisable to see your physician or your healthcare provider for that. All right, so that's basically it in a nutshell. Trying to recap our previous video. All right, so until next time, and a big thank you to all my subscribers. I really appreciate you subscribing to my channel, and I'm still asking, please, to tell a friend to tell a friend, to like, subscribe, and share these videos. Thank you. Until bye.